Hello and welcome to another episode of Macro Decode. The Middle East tensions and the disruption in travel has seen a reduction in the arrivals of overseas patients. To tell us how this has affected our healthcare service industry and how the industry is using technology to tide over the crisis, we have Anupam Sibal, Group Medical Director, Apollo Hospitals. Welcome to the show.
Good afternoon. Namaskar. Thank you for having me on your show.
Before we discuss the Middle East crisis, I would like you to give us an overall picture about medical travel in India. How big is this industry? Where do we stand globally in terms of providing affordable healthcare? And what are the opportunities vis-a-vis global competitors in the healthcare space?
See, India is a very attractive destination because of the value proposition that we offer, which is high quality, competitive cost. So, when I say high quality, the most complex of procedures are performed in India, and the best technology is available. Lots of expertise because of the amazing track record that Indian institutions have of high volume, case. And then, of course, our cost is very competitive. It's about a fifth of what it is in the US. It's about a third of what it is in Singapore. So when you look at how a family decides on which country to look at for their loved ones' treatment, they look at expertise, they look at experience, they look at outcomes, and we have institutions in India where the outcomes are comparable to the best in the West. We at Apollo have been measuring our outcomes, benchmarking them against the best published outcome for about 16, 17 years. So you have excellent outcomes. And when there is this advantage of cost that comes in, that really swings in our favor. So India is emerging as a very popular destination. Of course, others have been doing it before us, like many decades for very complicated work. Patients have gone to the United States, so people continue to go to the United States from different parts of the world. And of course, Germany is another important country. And if we look at the global south, then it's India, it's Turkey, it's Thailand, and if we look at the Americas and Mexico stand out as preferred countries. We have the advantage also of English, which matters to a lot of patients, and also the fact that the kind of environment that we have in our hospitals because multiple languages are spoken, but the food preferences vary from different states in the country. So our staff is very open-minded, and that's why we have patients from more than 150 countries who visited India.
How big is this industry in terms of earnings?
So it's a little difficult to put a figure on that, but what I can definitely tell you is that it's been growing at a good 15 to 20% a year. So Africa has become very important. Following that, it would be the Middle East. Then we have the Asian countries, CIS. Then we have South Asia, and of course, SARC has always been important in terms of getting patients into India.
Okay. Now, coming back to a current topic, tell me how is medical travel in general and how is the patient flow from the Middle East region in particular getting affected by the crisis? How
See,
much?
we have to realize that the Middle East is very important from a transit corridor point of view. If you look at patients coming in from Africa, so one big transit point is Addis Ababa in Ethiopia, Dubai, Abu Dhabi, and Doha are very important hubs for patients to come from Africa who change flights. Now, of course, Air India now flies to many destinations in Africa, but if you really look at the continent,
Yeah.
then patients usually have to rely on an airline with a transit. So all those airlines where the transit points are in the Gulf,
Yeah.
now that with the disruption creates a problem. So that is one. Second, with the disruption in terms of the supply lines, with the increasing cost of oil and aviation fuel,
Yes.
the airline costs have gone up, and that, of course, serves as a detrimental factor. So, if there's an uncertainty, you don't know if the flight's going to be cancelled or if it's going to take longer for a flight to take to come to your destination in India, then there's a sense of hesitancy that comes in. When it's a very elective procedure where someone has a choice of waiting for a few weeks, 2 months, and then the environment is becoming like it has over the last few weeks, then the family decides, okay, let's wait. When, of course, it's something like cancer or it's a heart condition or it's one of those conditions where, the treatment can't really wait, then the families will, make that extra effort and will travel despite these problems. But for elective or semi-elective procedures, there is hesitancy, which then results in deferment. So, families reach out to us and saying, listen, we want to defer this by a few weeks, 2 months. And that is absolutely understandable. What we try and do is maintain the care cycle, because we are a network of physicians that we work with across different countries. So we're in touch with them in terms of optimizing their treatment while they await travel to India. Technology comes in very well, very helpful that way in terms of whether it's telemedicine or just communication to be able to reassure families and work with the doctors.
So, altogether, can you tell me, like, this particular region from where, Middle East also does Africa, how much does it actually account for the total travel that is happening to it?
So Africa is a good 40-45%,
Okay.
and the Middle East is about 8 to 10%. So together they are responsible for more than 50%. So it definitely does have important ramifications. Let's see how it pans out. Hopefully things will settle and life will become a little bit easier for these families who are very keen to get their patients across and are trying to get their arms around some of these challenges that have come in their way.
Right. So you just said that you're using telemedicine and teleconsultation to reaching out to them, and I mean, who can probably delay their procedures a little bit. How has teleconsultation grown in recent times, and how big is this a revenue source for you?
So this is a service that we have over time been very actively involved in. It's been happening for more than 20 years. Then we established the first satellite-based telemedicine program. Now it has evolved, and it has evolved in that it has gone beyond consultations and follow-ups and assessments. It is about TG, telecardiology, doing an assessment. It is about teleradiology, where you can look at a CT scan report, you can look at an MRI and give advice, you can look at conventional X-rays and give advice. It is about also monitoring. There is a system in place where you can monitor multiple ICU beds through a command center where you don't have to be physically present to be able to give advice. So there are several different areas where telehealth is becoming very important and is serving patients through a variety of offerings.
Right. Apollo has been a pioneer in adoption of technology, including robotic technology. And now we are hearing a lot about artificial intelligence. We are stepping into the world of artificial intelligence. How do you plan to use AI in healthcare services?
So, our journey with AI started about 6 years ago, and we've been very actively involved in not just studying AI, but also helping co-development and, of course, adoption and adaptation. So there are more than 30 APIs that we've been involved in. I'll just give you one example of the artificial intelligence work that we've done in cardiovascular disease by looking at lots and lots of case records of individuals and have arrived at an algorithm that can predict who's likely to get cardiac disease 5 years, 10 years, 20 years from now, and what can be done to minimize that risk. Similarly, recurrence of breast cancer. A lot of work has been done in infection. Now with fatty livers, which is becoming a big problem in prediction, got partnerships from across the globe where we work with universities, we've worked with institutions, we've worked with companies to really take AI to the bedside, because the application of AI in a country to the size and scale of India, where 65% of our population is rural, there is tremendous potential. So somebody has a stroke, say in a village, and there isn't going to be a neurologist available, and they rush to the closest town, where again there might not be a neurologist. So get a CT scan done, and that will show whether this individual has a bleed in the brain or whether the individual has a thrombosis. India has more than 600,000 villages. Now, every village is not going to have a radiologist. So, lots and lots of potential of using AI to take it down right at the doorstep in the villages of India. And that's really what is very exciting with AI in healthcare. Working,
Okay. Do you think AI will make healthcare services more affordable?
I think it will remove a lot of redundancy in healthcare. There's a lot of repetition in terms of tasks that need to be done over and over again. Uses time, whether it's a physician time or a nurse time or a health worker time. That AI will take over. That means there's more time available for patient facing activities, for interacting with patients, with families. So that is very, very critical. But it'll make healthcare safer because, there'll be checks and balances that will get introduced. There is efficiency that will come in for sure. And then what will happen is that with better utilization of technology, we'll be able to offer the most appropriate treatment option to patients, and that will result in better outcomes. So, all in all, whether it's doctors, whether it's nurses, healthcare professionals, managers, or patients, everybody will benefit with.
And when efficiency comes, obviously, we will be able to reduce the cost also in the healthcare space.
Definitely. I mean, wherever you cut wastage, there is going to be an economic benefit.
Yes. And similar to every sector, healthcare also faces the threat of AI replacing humans. What are the jobs that are replaceable with AI in healthcare?
So I don't think any of the healthcare jobs which are actually about patient care are replaceable. What you can replace is clerical positions, all of those where you don't really need a clinician or someone who's got a lot of experience and training involved in clinical care. Those kind of jobs can be replaced, but obviously you're not going to be able to have AI come in place of doctors or nurses.
Right. And lastly, in an interconnected world of technology, where do you see India in the coming decades as a healthcare?
Yeah, India in healthcare is going to really enjoy a position of advantage. So we talked about in India, we talked about patients coming in. We also have this great opportunity with young population and healthcare being very popular, and the fact that we more than doubled our postgraduate and undergraduate seat capacity in the last 10 years for us to produce enough healthcare professionals, not just for India, but for the aging global citizen. So heal by India, where Indian healthcare professionals go and work abroad, like, in the developed world, but not just the developed world, but also in the global south. And of course, India is the third largest manufacturer of medicines. And, Indian pharmaceutical industry is very well recognized. Nearly 50% of all vaccines in the world are made in India. Similarly, India is now making efforts to improve our ability to compete in the international medical device, area. So the ability to produce devices is increasing. So that is all about heal by India. And then, of course, the third aspect is heal from India, where a patient is outside, but the monitoring is happening in India through all these devices where you can actually track, assist, monitor, and help provide care. So great position for India. And, we've always been very cognizant of cost. So frugal innovation is something that comes naturally to us, and the cost benefit will, of course, in times to come be very well recognized.
Thank, yeah.
Thank you, Sangeeta.